Welcome back to the Morning Blend. It's that time of year again that we focus on one of the most important decisions a person can make when it comes to their well-being. It's time for Medicare open enrollment.
That's right, and joining us once again to help is Gary Denning with United Healthcare, Medicare, and Retirement in Nevada. Gary, great having you, my friend.
Well, thank you. It's great to be here again.
All right, so it's that time of year. Once again, open enrollment, seniors, other people enrolled in Medicare. Why is now such an important time of the year?
Right. Well, Medicare is so important. In fact, one of the most important decisions that a person can make, not only for their health and well-being, but also for their wallet. In many cases, this is the only opportunity that individuals will have to choose a Medicare plan for next year. And so if they choose not to make that plan, they're going to be locked into their existing plan for next year. Now, if there are any changes, either with their existing plan or with their health care or with their budget, they may miss an opportunity to lock in additional savings and to have great care. So it's very important that they investigate this. Medicare is not a one-size-fits-all program, and so you have to really dig into this and figure out what's best for you.
Now navigating through Medicare plans can be like a maze. How do you make this process easier?
It can feel like a maze, unfortunately, and it really shouldn't. In fact, our company did a survey this past year to gauge individuals' level of comfort with Medicare, and we found that almost 40% of beneficiaries found it confusing, and that really is a shame. United Healthcare, we're so focused on education that we created a website, MedicareMadeClear.com, to help people cut through the challenges and the misunderstandings that are out there.
Can we just let's do Medicare Parts 101? There's the A, the B. Is there a C?
There is. There's
a D?
A, B, C, and D
are
the four
main
main parts.
Okay.
And so you have Medicare A and B, which is considered original Medicare.
Okay.
Part A typically covers your hospital costs. Part B, your doctor costs. Part C, or Medicare Advantage plans, combine A and B, usually include your prescription drug coverage, and also may offer additional benefits. So Part D is the drug coverage that is included sometimes in your Part C, or can also be offered as a standalone plan.
So C is often Parts A, B, and D combined.
Correct. Now you also have, to make it even more interesting, you have Medicare supplement plans, or also called Medigap plans, and those can help to cover the costs that A and B don't typically cover.
Now, you had mentioned Medicare Advantage as one of the options.
Right.
Now, what is driving that growth?
Yeah, over the past 5 years, there's been nearly 50% growth to Medicare Advantage enrollments. And I think that in part is because of simplicity. Medicare Advantage plans, again, include Parts A, B, and D in most cases, as well as additional benefits. And with United Healthcare locally, those additional benefits are things like vision, dental, and hearing, transportation benefit, over-the-counter benefits, even gym membership, access to 24/7 care for your doctors or nurses. We have a 24-hour nurse line. We have virtual visits on your device where you can see a doctor. So
that's
just some great benefits. And then lastly, and perhaps most importantly, unlike Medicare, original Medicare, Medicare Advantage plans, they lock in, they have a maximum out-of-pocket, which means that they cap or lock in your costs. So if something unexpected occurs, you don't have to worry that your costs are going to be, unknown. It's locked into that maximum out of pocket.
You know exactly what the worst case scenario could be.
Exactly.
Wow. I know. So this, with the exception of if you have a chronic condition that happens to pop up in the next year, this is the time to be signing up for these plans.
Yes. During the open enrollment period, that's October 15th to December 7th, is your time to make choices. And those choices will then go into effect January 1st. And will be your coverage from January 1st till December 31st of 2018.
Gotcha.
Now, sometimes people think of Medicare as simply something you pay for healthcare, but the plan you choose can actually impact your overall health and well-being. How does that work?
Yeah, one of the great things, particularly with United Healthcare, we're moving from health insurance to health care and coverage to make people, healthier, to help them live longer lives. And so we have a great story of Miriam. She's one of our members that lives in Colorado, and she's on one of our Medicare Advantage plans there. We noticed that she hadn't had a mammogram in the past couple of years. And so one of the services that we provide is outreach to make sure that people take advantage of those preventative services. So Miriam, while we were on the phone with her, scheduled an appointment with her doctor. She goes to her doctor, finds out that she has early stages of breast cancer. And because of that intervention, she was able to get treated and is now living a very healthy life. What's important for folks to realize is the powerful impact that health insurance companies like United Healthcare are now taking to help people live healthy, happier lives.
Absolutely. Sometimes in this country, we don't necessarily think about fixing things before they get to that point. So for you guys to be able to say, hey, listen, you're paying for this service, use it.
Exactly.
Is great.
Right. We want to make sure that everyone knows what's included in their plan and that they're taking full advantage of it because it will help them be healthy.
Gary, pleasure as always, my friend.
Thank you.
Thank you so much. Sometimes people think of Medicare as something that you just buy to pay for your health care, but it's something way more than that. If you want to learn more about United Healthcare and the things that they can do for you, got the information right there on your screen. They also have a Medicare store where you can learn more info. One's on Sanea, the other one is in Henderson. United Healthcare, rather, is a proud sponsor of the Morning Blend.